Hello, Colin Hung here for Healthcare IT Today. And I'm here in Chicago, Illinois for the RSNA 24 conference. I'm here at the Rapid AI booth, and I'm about to interview Amit Fadnis. He's the Chief Innovation and Technology Officer here at Rapid AI. While I've been here at the conference, I have been on the hunt for meaningful and legitimate uses of AI that's furthering the radiology practices. When I heard about what Rapid AI is doing, I couldn't wait to come over and find out more. Let's get to it. Amit, welcome to the program.
Thank you.
I'm excited to be here at the Rapid AI booth. Before we dive in to talk about some of the announcements you're making here, can you give us a little bit about your background and a little bit about Rapid AI?
Oh, absolutely. Uh, Amit Fadnis, I'm the Chief Innovation and Technology Officer for Rapid AI. Joined Rapid AI about 2.5 years back. Before that, I was a Chief Digital Officer at GE Healthcare. And then before about 25 years in the tech industry.
Nice. And tell me a little bit about Rapid AI. What is it, the solutions?
Yeah, so Rapid AI is a company which basically, helps clinicians, especially in the acute care settings. We have a solution in stroke. We actually pioneered the solution in stroke and changed the entire care pathway. But then we have sort of branched off to other multiple disease states, right? Both acute as well as non-acute. We basically do what is called deep clinical AI,
Okay.
which means that we do a lot more than what is typically called a triage notification, which is just suspected something. We go way beyond that, right? We basically localize the disease, we quantify, we characterize the disease, and very importantly, we also do advanced visualization. And you can sort of see in the background, some of the things that we produce, so that the clinician can actually visualize, what really is going on with the patient and give them deep insights. And we do that predominantly through AI, but we also have a full workflow solution on the mobile. We can actually interface with different other IT systems that the hospital has.
Now, this deep clinical AI, what's the response been? Because I have heard that maybe some doctors are a little bit hesitant of looking at technologies that help them diagnose things, but you're saying that your deep clinical AI is a little bit different than that. Is that right?
No, absolutely. I mean, look, typically what you will find is that most companies use data, generate an AI model, and essentially what they're saying is that there's something wrong with this patient, right? That doesn't necessarily help radiologists. That doesn't necessarily help the clinicians, because when you say that something is wrong, you're now looking at a stack of about 1,500 images. You're saying, okay, so what's wrong? Where is it, right? And what's the level of the disease and things like that, right? So we need to give them a lot more insights into what really is going on with this particular patient. And it is not so much that you need to diagnose the patient, but what you need to give them is enough information so that they can do an accurate diagnosis and they can do it fast.
Here at RSNA 24, you've made a number of announcements as a company. Can you share more details about what you've announced?
Yes, absolutely. So first of all, we've announced a few modules, right, which is basically AI algorithms, right, that we are doing. But very importantly, we've announced an initiative called the Rapid Navigator Pro.
Okay.
Now, essentially what it is an interface that we provide the radiologists. The radiologists use a system called PACS, to read images.
Yep.
Rapid produces a lot of output, through AI, which requires, which will, they are required to sort of interact with it, right? And Rapid Navigator Pro is an interface where seamlessly through their PACS workflow, they can get into our backend, they can interact with the AI output, they can reprocess if required, and we can seamlessly sort of push the results of that back into PACS again, right? Now, this is super important for radiologists because, a couple of reasons, right? One is that they want to make sure that when they interact with systems like this, that interaction absolutely seamlessly fits in their existing PACS workflow.
Okay.
They're already overburdened, right?
Sure.
They're facing burnout. Last thing they need is we give them an interface where they have to come out of PACS, they have to do something here, look at a different application, and then go back into PACS, right? And it's not a workable solution. Now, the Rapid Navigator Pro, the way it has been designed, is that it makes that entire interaction completely seamless, right? So you're logged into your PACS, you don't have to log in again, you're straight into the Rapid application. You can interact with it, right, maybe on a second monitor, sitting on your PACS, right, specifically, and then get the results back seamlessly You can view, multiple results, right, if required. So it really eases out, what they need to do, right, to get better insights while they read a particular patient study.
I like that because, as you said, there's enough burnout already, and
Absolutely.
so making the clinician conform to another workflow is not good. You've integrated your solution to make it more seamless for that
Right. And there are
individual.
other aspects of it, right? For example, we got a lot of feedback saying that, hey, you're giving us a lot of information.
Mhm.
And then, they basically look at that information there to read that out and put it in the report, right? So the Navigator Pro also auto-populates the report for them, right? So all of the AI findings that goes into a report that they can basically scan through, hey, I agree with this, I'll sign this off, and it's done,
I
right?
like that.
So I think there are many aspects of this, that really eases out the workflow from their standpoint.
I like that. I mean, if I was a clinician and you were in front of me, what would you say to me to convince me that I should really give this deep clinical AI a shot as opposed to maybe some of the other ones that I've seen out there? Because I got to admit, I think a lot of them might be a little skeptical as to whether or not you're able to show a disease state.
So first and foremost, right, we are here to assist you
Okay.
as a clinician, right? We want to give you information that's very hard for you to do manually, right? There are so many things that happens on an image that are very difficult to sort of see through a normal human eye, or it takes a lot of time, right? So we want to ease out those things, right, which are difficult to do, but extremely important for you to make a clinical decision. We are not the one who is making the clinical decision. You're the one who is making the clinical decision. But can we do it in such a way that it eases out the burden on you to actually do that, right? Now, for us to do that effectively, you're looking at an image which has 1500 slices, right? Or maybe even 600, 700 slices, which means there are 600, 700 images, okay, that you have to scan through. There is a lot that AI can do, in terms of localizing where the problem is, characterizing it, measuring it, right? Creating visualization so that you can actually see. I mean, we create color maps and things like that, where we can actually see, okay, here is what exactly is going on. Here is where the bleed is, right? Or here is the volume of the bleed, right? Things like that. That can tremendously help a clinician to get to a conclusion very quickly in his or her mind as to what really is going to be happening with this particular patient, and more importantly, what's the treatment path, right? I mean, that's what the patient is all, that's what the outcome is all about, right?
And it sounds like your AI has gone through a lot deeper training than maybe some of the other AIs out there, because as you said, it's not just detecting that something may be wrong, it's actually getting a lot deeper than that. So have you spent a lot more time investing in your AI and really training it very differently than other ones out there?
Absolutely, in two ways, right? One is, first of all, you need a lot more clinical depth,
Mhm.
right? And one of the big differentiators for Rapid AI is we were founded by clinicians. So there is a tremendous amount of clinical depth that we bring to the table, right? So that's first and foremost. But then there is the whole deep clinical AI is a process that we have implemented, right? As to how we develop our AI algorithms, right? Right from what type of data we use, how do we curate that data set, what are the indications that we are looking for very specifically. And then we also combine AI with some of the other software techniques, right? Including image processing and things like that, so that we can actually bring out those elements very clearly in front of the clinician that they really care for, right? And I think the whole process is there is not one thing that is deep clinical AI. It's the whole process of how, what clinical knowledge we are applying, what problem we are trying to solve, and then the whole pipeline of how we develop the AI, which is what makes it differentiated.
Well, Amit, you've got me convinced. Thank you for that. You've shared a lot of great information. Amit, where can people go to learn more about Rapid AI?
Well, so first of all, rapidai.com, or website, but you can also sort of reach out to us through the website, and we will be very happy to, sort of spend more time with you.
Excellent.
But the website also is a very good starting point.
Excellent. Well, Amit, thank you so much for your time today, and I really appreciate you coming on camera with me.
Thank you so much, Colin.
Hey, I really want to thank Amit for coming on camera with me and giving me that overview of Rapid AI. It is very impressive, the work that they're doing to really go beyond the surface level AI that a lot of other companies have, where they're just detecting whether something is normal or abnormal. As he put it, they're going deep to really help radiologists make a determination as to whether or not there's something there. If you enjoyed this interview, please mash that like button and also click subscribe. You can always head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung here in Chicago, Illinois for RSNA 24. Thanks for being here, and I'll catch you on the next video.